Topical phacoemulsification with intraocular lens implantation in a case of mature brown cataract by Dr. Aarshinoff Das. After making a 2.2 mm temporal clear corneal tunnel, trypan blue is injected to stain the anterior lens capsule. A viscoelastic is then injected into the anterior chamber and anterior capsulorrhexis is completed. Note that the increased intralenticular pressure can make this a runaway rhexis, so it is advised to perform this step slowly and steadily under a well-formed anterior chamber. A side port incision is then placed 90 degrees away from the main incision. It is ensured that the nucleus rotates freely in the bag after minimal hydrodissection. Note the soft shell technique of viscoelastic injection here. A dispersive viscoelastic injected first protects the corneal endothelium, followed by a cohesive viscoelastic which maintains good anterior chamber depth. Initial debulking of the brown nucleus is done by trenching up to 2/3 of its depth. The settings used here are 40% Phaco power with white star, aspiration flow rate of 28 cc per minute, and a vacuum of 110 mm of mercury. The next step is nucleus disassembly with a micro finger phaco chopper. This is followed by quadrant removal using 40% Phaco power with white star, 30 cc per minute aspiration flow rate, and 280 mm of mercury vacuum. Now, removal of the last piece requires particular attention since there is no epinuclear cushion to protect the posterior capsule. The minimal cortical matter is then aspirated using a coaxial irrigation aspiration system. The capsular bag is inflated with viscoelastic and a foldable intraocular lens is implanted through the temporal clear corneal tunnel. The viscoelastic is now aspirated, the IOL is perfectly centered, the corneal tunnel and side port are hydrated, and the anterior chamber is formed with balanced salt solution. And that completes the surgery.